I am here with Dr. Ben Atkins. So thank you so much for joining me, Ben. You are my very first Dentistry Top 50 interview. So thank you so much for joining me.
Thank you very much for the offer. Yeah, great.
You look like you're sat in a beautiful part of the world.
Do you know what? The kids' first day back after Easter, and I always take the day off after my kids go back because it seems things seem to settle. I've had a nice coffee, relaxing this morning, bit of me time. So you've caught me in the sunshine, so it couldn't be better, really.
Excellent. So Ben, can you just formally introduce yourself? I know the majority of people know you already, but for those of you that don't.
My name's Ben Atkins. I am a general dental practitioner from the sunny north. It's always sunny in Manchester. I had about 11 dental practices. My focus was the NHS and the hard to reach patients within that. So we had a homeless service. We did the out of hours for Merseyside, Cheshire, and quite a lot of Greater Manchester. I'm the current president of the Oral Health Foundation. Yeah, I'm dad of 2. Keep bees, which my beehives are just down that way.
Fantastic.
So, yeah, that's good.
Brilliant. Well, now I've moved house, that's something that I would love to do myself as well.
Good fun.
So pick your brains, get a few tips. So Ben, how are you feeling about being voted into the top 50 and this accolade?
I think, like everything else in dentistry, I do feel a bit of imposter syndrome sometimes, because you see the rest of the guys who are on the dentistry top 50, and I'm not sure why I should be there, to be honest, but it's a real honor. It's a real nice thing that I've had done, and I'm just waiting for someone to discover it's not really me. But there we go. That's good. It's something that it came as a shock last year, and it came as even more of a shock this year when it was I enjoy what I do. I just enjoy what I do. So it's nice. It's just a shock, really. Yeah.
So how much does it mean to you?
It means a heck of a lot, really, because it's something that you don't enter. You know, it's not one of these. I'm a judge on quite a few of the awards within dentistry, and the amount of work that goes into those with general practitioners doing that is amazing. This is just sort of voted by your peers, and it's not a competition, really. You know, it's a really nice. It's about pat on the back, really. Yeah, it's lovely. It's
nice. Brilliant. So Ben, this is about finding out about you as a person, because we see what you do, but it's about delving deeper into who you are, and for the audience to really engage with you, you know, on a human level. So what drives you to do what you do, Ben, and make a change in the world of dentistry?
It's a really good question, and it's one of those. I always do when I do quite a bit of mentoring, and the biggest question I give my mentees is why? What do you do this for? Because we've got an amazing profession. If you enable it, if you put your head above the parapet. And for me, it's learning. What I do is, once I understand something, I lose interest very, very quickly. So I love new projects. Even if I might not agree with something, I want to find out about it, because everybody's got this amazing inner self in awareness if they empower themselves to grow. And I get frustrated with myself for stagnating sometimes. So whatever I do is for learning. It's felt very selfish, and it's all about learning, and it's all about growing my mindset, I suppose. We all have different drives. I mean, the business of dentistry for me was always about making sure my family was safe and secure, and yes, so it's about that growth within yourself.
Fantastic. So, you know, we all have our challenges, you know, as we go through our professional life. So is there any particular challenges that you faced and had to overcome to progress and learn and see that personal and professional growth that you've achieved?
I think that there's been some very dark times within my profession. You know, it's not all the positive side you see on Facebook and all that sort of stuff. There's some real challenges within my journey as a clinician, and also as a business owner and a dad. You know, it's that the biggest thing for me, the biggest challenge is not using dentistry often as a safety net. If other things are focusing, since I've sold my business, I've realized I've lost contact with often the people that I love, The people who are the closest to me, my old housemates at university, for example, I've made such a concerted effort to meet up with them more. They spread around the world now. It's very easy to use dentistry as almost as a crux, an easy option just to fall into that conversation of dentistry and teeth, which I love. I absolutely adore being a dentist, but having that ability to go for a coffee with a friend is so much more important to me.
Yes, absolutely. So what personal advice would you give to anybody listening to help them really focus right now and achieve their goals, you know, for the future, despite the adversity that we're still facing?
I think there's a few. I think this, the COVID journey we've been through and still are going through is only a short period of our lives. And I think we've got to understand that ultimate goal hasn't gone away. You know, whether it's the ability to 4 days, 5 days a week, as my case, I can drop my children off and pick them up from school and be there for them. That's my biggest worry of the moment, is that, am I going to be there as a father? Am I going to be there as a husband? Or what's my longevity for? Where do I want to be? And understanding that is probably the biggest challenge we do. I mean, my friends laugh at me, the fact I wrote my obituary. When I first started being a dentist, I knew where I wanted to be. But it wasn't that moroseness. It was the actual, I needed a proper goal and a target, a long term, and to get out. My business was totally set up to sell. It wasn't Ben Atkins and Associates, because no one really wants to buy me. They want to buy my business. And that worked out really well. But I think the biggest thing, the biggest advice is understand what makes you smile and do more of that. So yeah,
Brilliant. Excuse me. So how do you view the future of dentistry, Ben? You know, once we get out of this, the worst of the COVID period, how do you see the future for dentistry?
I think dentistry is going to evolve and has evolved rapidly because of this COVID war that we're going through. I think we must take the opportunity to communicate to our patients how safe we are, how we have evolved pre-COVID, and this cross-infection wasn't a massive change. It was, but we need to show that to our patients. You know, the rules were already there. We follow the guidelines. We're a safe place to be. As a professional, the dental market, we know, or the oral health of our country has improved. So you speak to any of the industry, and the dental industry is shrinking, it's contracting, because the oral health are improving. So as a business, we have to make sure that our patients value who we are, value what we do, and that communication will increase, and it has increased. You see that the dental profession is dramatically improving the communication with its patients, improving our journey, improving what we can do, because we're an amazing source of, we're an amazing resource for our community to work with, whether it's someone to talk to. We will see our patients, possibly, especially through the COVID period, we were the only people patients sometimes saw when they're having toothache, you know, that contact, and that value is so intricate in society.
Absolutely.
So I do feel there is one side, the dentistry it's shrinking, but other areas we've that shrinking is increasing the opportunity to treat the hardest to reach in society, where the massive amounts of decay are. It's Dickensian, some of the stuff we used to see. So it's really important to take a step back as a profession and a professional individual and say, how can I evolve to make sure I've still got a massive amount of work for the next 20 or 30 years? So we're not just the aesthetical pretty stuff. It's actually the stuff that we do so intricately, 95% of what we do in dentistry anyway. So Ben, what's your next professional goal? What's ahead for you? My next professional goal, that's something I fight with quite considerably, because it's these 2 years were meant to be my time out of dentistry, selling the business, relaxing, recuperating. I haven't quite had that yet, but I think I've got a couple of projects on the go. One is about the homeless and hard to reach, and getting patient dentists to understand that they can use their, especially their NHS contract, in the way that suits them, that way that they feel that they can contribute to society and manage that. That understanding of need and want within dentistry is absolutely critical, and stimulating and supporting my colleagues into evolving and growing their businesses. If we can do that, would be absolutely amazing. And it's what, all the way through my career, I've never fought against the system, because the system is too behemoth to change. It's too behemoth, but you've got to use it. That change needs to be a long-term goal. That needs to be a 10, 20-year plan.
Yes.
And that's where you need to be involved with the BDA. You need to be supporting your union and working and doing that, because they are amazing at that. But on an individual basis, you need to be using your contract to suit your patient base and actually speak to where you want to be. Because what I mean, for example, one of our contracts, we actually focused our UDA contract on working with the asylum seeker groups, and that was very, very rewarding. Don't talk about that much, but it's using how you can use your NHS service and also then complement that with a private growth. So it's not just this, oh, the NHS is going to be one thing. It's having that advantage of having multiple resources into your business. And there's some really exciting times. So working with that communication, and my biggest drive is communicating to patients how complicated dentistry is.
Yes.
But we make it simple.
Yes.
You know, and that value is intricate in where we're going to be going over the next 10 or 15 years, and communicating to patients that they are responsible and for their oral health, and don't expect the dentist to go, right, fine, I'm just going to drill your teeth and forget about you.
Yes.
No, I can do more damage with a drill than decay will ever do. But if I make sure the patient is perfectly oral health journey for the first 6 months of my interaction with that patient, and then prove afterwards, if I put a filling in then, that it's healed, it's almost, we'll never get back to being a full perfect tooth. But that evolution of behavior change is critical to where we're going to be over the next, now really.
Yeah, absolutely. So Ben, as a human being, what are the things that you value most in life?
Time. That's it. Time.
Say that again, sorry.
Time.
Yeah.
The biggest thing I value is the ability to do nothing and actually not think that far off, be living in the moment. And I think I've done that too much throughout my career, with thinking about what's coming next. Well, actually, I enjoy the day that I am in clinic, or I enjoy the day that I'm with my management team, or I enjoy the day I'm sitting talking to you on another Zoom call. No, you know,
with
and I think it's
beautiful weather behind you.
Absolutely, and appreciating that and having that time, and not think dentistry isn't everything. No. It really isn't. It's part of your journey. It's part of your life. And not using it as something to hide behind, because there's other things that need to be sorted out. Like, I've got to see my bees today, because that's much more important.
So where do you see yourself in 10 years' time, Ben?
Still sat here.
Yeah.
I'm quite comfortable where I am now. I appreciate where I am. I don't need to. I'll be fitter in 10 years' time than I am now. And I know I will be, because I'm working with my coach and a plan to do that, because I really feel it's important to have that mentor role. I'll be still mentoring dentists and mentoring anybody who wants it, really. You know, it's I've reached out by a dental nurse the other week who wants to set something up for herself. She just wants to ask me some questions. And I think that's really important, that mentorship role.
Yeah, I totally agree. Totally agree.
And if I'm still doing that now in 10 years' time, then I'll be happy, really. Yeah.
Fantastic. Fantastic. Well, Ben, thank you so much for joining me this morning. It's been lovely to talk to you, and many congratulations again. And I will let you get back to your bees.
Absolutely. See you soon, Nicki.
Okay, thanks so much, Ben.
Bye-bye.
Take care. Bye.